Hello, everyone. Hope you're doing well today. We are continuing our conversation in Chapter 11. We're going over more of cardiovascular endurance, speed, and agility today. So here we go. Cardiovascular endurance, also known as cardiovascular fitness or aerobic endurance, refers to the ability of the cardiovascular system, the heart, blood vessels, and lungs, to deliver oxygen to the working muscles during prolonged physical activity. It is a measure of how efficiently your body can use oxygen to generate energy for extended periods. Improving cardiovascular endurance has numerous benefits for overall health and fitness. Here are a few key points. Heart health. Regular cardiovascular exercise strengthens the heart muscle, improves blood circulation, and reduces the risks of cardiovascular diseases such as heart attacks, high blood pressure, and stroke. Increased stamina. Enhancing cardiovascular endurance allows you to perform physical activities for longer periods of time without feeling fatigue. This can include activities like running, cycling, swimming, or even daily tasks that require sustained effort. Weight management. Engaging in cardiovascular exercise helps burn calories, contributing to weight loss or weight maintenance. It increases the body's energy expenditure, making it an effective tool for managing body weight and reducing excess body fat. Improved lung function. Regular aerobic exercise enhances lung capacity and efficiency, allowing for better oxygen uptake and carbon dioxide removal. This can lead to improved respiratory health and increased endurance. Mental well-being. Cardiovascular exercises release endorphins, often referred to as feel-good hormones, which can help reduce stress, alleviate symptoms of anxiety and depression, and improve overall mood and mental well-being. To improve cardiovascular fitness, it is recommended to engage in aerobic exercise that elevates the heart rate and keeps it elevated for an extended period of time. Activities like running, swimming, cycling, brisk walking, dancing, and playing sports like soccer or basketball are excellent options. Start with a moderate intensity and gradually increase the duration and intensity of the workouts over time. Submaximal cardiovascular endurance tests are commonly used to assess an individual's aerobic capacity or cardiovascular fitness without pushing them to their maximum effort level. These tests provide valuable information about an individual's ability to sustain physical activity over an extended period and can help determine their fitness level. Here are a few examples of submaximal cardiovascular endurance tests. It is important to note that while submaximal tests provide useful estimates of cardiovascular fitness, they are not as accurate as maximal tests, where individuals perform at their highest intensity. Maximal tests such as the Bruce or bulky treadmill tests are more precise, but require professional supervision and may not be suitable for everyone. Typically, they will be done in a hospital with a physician close by. The cycle ergometer test is a common method used to assess cardiovascular endurance and estimate an individual's maximal oxygen uptake, or VO2 max. By measuring their performance on a stationary bicycle or cycle ergometer, it provides valuable information about aerobic capacity, cardiorespiratory fitness, and the efficiency of the cardiovascular system. Here's an overview of how the cycle ergometer test is conducted. A cycle ergometer or stationary bike with adjustable workload or resistance settings is required for the test. The bike should be set up properly to ensure a comfortable and safe riding position for the participant. You want to begin with a warm-up period of light cycling for, it says 5 to 10 minutes, I would say probably 2 minutes, to prepare the cardiovascular system and muscles for the test. This helps increase blood flow and body temperature. There are various protocols for cycle ergometer tests, but the most common ones include the Austrian rhyming test and the YMCA test. The Austrian rhyming cycle ergometer test is performed on a stationary bike or cycle ergometer. The individual cycles at a submaximal intensity, typically for 6 minutes, while their heart rate is monitored. Based on the heart rate response and workload, an estimation of the individual's VO2 max can be made. Similar to the Austrian rhyming test, the YMCA cycle ergometer test is submaximal and is conducted on a stationary bike. The individual pedals at a specific workload, usually set based on their age and fitness level, for a set duration, such as 3 minutes. Heart rate is measured during the test, and the results are used to estimate VO2 max. At the end of the protocol, you'll do a cool down, and they'll cool down by cycling at a low intensity for several minutes to gradually decrease their heart rate and allow for recovery. It is important to note that while cycle ergometer tests can provide reasonably accurate estimates of VO2 max, they are not as precise as maximal exercise tests performed under supervision in a laboratory setting. Additional factors such as fatigue, motivation, and proper bike setup can influence test results. Now, with this, please make sure that you are checking the text for more information regarding the protocols. Really important that you know what those are. It's difficult in this setting to be able to go through all of that with you, and so I'm expecting for you to be able to do that on your own. The STEP test, also known as the Harvard STEP test or the YMCA STEP test, is a simple and practical method used to assess cardiovascular fitness and estimate an individual's aerobic capacity, or VO2 max, by measuring their heart rate recovery after a set of stepping exercises. Here's an overview of how the STEP test is conducted. You will need a sturdy step or bench that is approximately 16 and a quarter inches in height. You may also need a metronome or smartphone app that can provide a consistent cadence. Before starting the test, it's essential to ensure that you are physically capable, that your individual is physically capable of performing the exercise. And also, you may want to consult with a healthcare professional prior to having them do the test. You begin with a little warm-up of light aerobic exercise, brisk or walk, jog, something along that line, for 2 to 3 minutes to prepare the body for the test. Position them in front of the step or bench and step up with the right foot, followed by the left foot, then step back down with the right foot, followed by the left foot. You repeat that sequence for a specific duration, such as 3 minutes. During the exercise, maintain a steady rhythm or cadence, which is usually set at 24 steps per minute, but depends upon whether that's male or female. Up, up, down, down counts as one step. Try to maintain a consistent pace throughout the test. Immediately after completing the stepping exercise, you're going to have the individual sit down quietly and measure their heart rate. Ideally, you should measure it for 1 minute, but if that's not feasible, measure it for 15 seconds and multiply the result by 4 to get the heart rate per minute. Record the heart rate at the end of the exercise, as well as the time it took for the heart rate to return to its resting heart rate. This recovery period is typically measured for 1 minute, 3 minutes, or 5 minutes after completing the exercise, depending upon which protocol you utilize. The recovery heart rate can be useful to estimate your cardiovascular fitness level. The faster the heart rate recovers to the resting level, the better the cardiovascular fitness. It is important to note that while the STEP test provides a reasonable estimate of cardiovascular fitness, it may not be as accurate as maximal exercise tests performed in a laboratory setting. Factors such as fitness level, age, gender, and individual variability can influence the result. Distance run or walk tests are a common method to assess cardiovascular endurance and overall fitness by measuring how far an individual can run or walk within a specified time frame. These tests provide a practical and straightforward way to gauge endurance levels. Here are a few examples of distance run walk tests. The Cooper 12-minute run test. In this test, individuals run as fast as they can within 12 minutes. The distance covered is then recorded and used as an indicator of aerobic capacity and cardiovascular endurance. It is a simple and widely used test suitable for individuals of various fitness levels. The 1-mile run test. The 1-mile run test involves running 1 mile as fast as possible. The time taken to complete the distance is recorded and can be used to assess cardiovascular endurance and running performance. The 1.5-mile run is a popular cardiovascular endurance test that measures an individual's aerobic fitness and running ability. It's often used by military, law enforcement, and fitness organizations as a standard assessment of endurance and overall fitness level. The 6-minute walk test. This test is often used for individuals who have limitations in running or not able to run due to health conditions or age-related factors. The individual walks as fast as possible for 6 minutes, and the distance covered within that time is measured. It provides an estimate of cardiovascular fitness and endurance. The Rockport Walk Test is a submaximal exercise test used to estimate an individual's aerobic fitness level and VO2 max based on their performance in a 1-mile walk. It is a popular, straightforward test that can be performed by individuals of different ages and fitness levels. These distance run walk tests can be performed in various settings, such as on a track or measured on a route, or even on a treadmill in some cases. It is essential to warm up adequately before these tests and make sure that, again, with your individuals, that if you need to consult with a healthcare or fitness professional prior to doing the tests. And as mentioned earlier, you want to make sure that you check the norms that are given in the text, make sure that you're using the specific norms for that particular test. Estimating VO2 max, which is a measure of aerobic capacity, without performing an exercise test can be challenging. However, there are a few non-exercise based methods and formulas that provide rough estimations based on factors such as age, sex, body composition, and resting heart rate. The fitness index equation estimates VO2 max based on resting heart rate, age, and body mass index. The non-exercise equations developed from self-reported physical activity can estimate maximal oxygen uptake, as well as submaximal exercise testing. The International Physical Activity Questionnaire, or IPAC, is the most widely used and validated self-report measure of physical activity. It is important to note that these formulas provide estimations and may not accurately reflect an individual's true VO2 max. Direct exercise testing, such as maximal treadmill or cycle ergometer tests conducted in a controlled laboratory environment, remains the gold standard for determining VO2 max. Speed refers to the ability to move quickly or cover a distance in a short amount of time. In the context of athletics and sport performance, speed is an important physical attribute that plays a crucial role in various activities, such as sprinting, running, and certain team sports. Agility refers to the ability to change direction quickly and efficiently while maintaining control and balance. It is an essential attribute to sports and activities that require rapid changes in movement direction, such as soccer, basketball, tennis, and martial arts. These tests are commonly conducted in sports performance settings to evaluate an athlete's speed, agility, and overall movement capabilities. The 40-yard straight line sprint test is a popular test used to measure an individual's speed and acceleration over a short distance. It is commonly used in sports such as American football, where short bursts of speed are crucial. Here's an overview of how the test is conducted. Equipment: you will need a flat and clear straight line track or field that measures precisely 40 yards. It's essential to have accurate timing equipment such as a stopwatch or electronic timing system to measure the sprint time. Before the test, it's important to ensure a proper warm-up to prepare the muscles and cardiovascular system for the sprint. This can include some dynamic stretching, like jogging, and other activities to increase body temperature and activate the muscles. Participants start in a stationary position behind a starting line. On the go signal, they sprint as fast as possible in a straight line for 40 yards or until a clearly marked finish line. It's crucial to maintain proper running form and exert maximum effort during the sprint. The time taken to complete the 40-yard sprint is recorded with precision. The timing should begin when the participant initiates movement, often when their foot leaves the starting line, and end when they cross the finish line. Multiple trials or repetitions of the sprint may be conducted to ensure accuracy and account for any variations or inconsistencies in performance. Rest intervals between repetitions should be sufficient to allow for adequate recovery. The recorded sprint times can be used to compare and evaluate speed and acceleration capabilities among individuals or to track progress over time. Factors such as technique, reaction time, and explosive power contribute to performance in this test. Remember, it's crucial to ensure safety during the sprint test. Participants should be adequately warmed up, and the sprinting surface should be clear and free from hazards. The 300-yard shuttle run, also known as the shuttle test or the beat test, is a cardiovascular fitness test that allows an individual's speed, agility, and endurance. Assesses the speed, agility, and endurance. It is commonly used in sports and military settings to evaluate an individual's aerobic capacity and anaerobic endurance. Here is an overview of how the 300-yard shuttle run is conducted. You will need a flat and clear running area, typically a marked track or field that measures 25 yards in length. Cones or markers should be placed at the starting line and every 25 yards along the course. Before the test, ensure that participants are adequately warmed up through light aerobic exercise, dynamic stretching, and running drills. It is essential to emphasize the importance of proper running technique and safety precautions. Participants start at the designated starting line and run back and forth between the markers placed 25 yards apart. The test involves running 6 laps, down and back 6 times, to complete a total distance of 300 yards. Participants are typically required to complete each 25-yard shuttle within a specified time indicated by an audio signal, beep, or visual cue. The time allowed per shuttle may progressively decrease as the test progresses, making it more challenging. Participants continue running until they can no longer maintain the required pace or fail to reach the marker before the signal. The level, lap, or shuttle completed at the point of exhaustion or failure is recorded. The recorded level or shuttle number indicates the individual's performance and can be used to compare fitness levels or track improvements over time. The recorded level or shuttle number can be converted into an estimate of aerobic capacity, or VO2 max, using appropriate conversion tables of VO2 or formulas. The higher the level or shuttle completed, the higher the estimated aerobic capacity. The 300-yard shuttle is a demanding test that requires a combination of speed, agility, and endurance. Participants should be in good physical condition and have a base level of cardiovascular fitness before attempting the test. The T-test, also known as the agility T-test, is a widely used test to assess an individual's agility and change of direction ability. It measures the time taken to complete a series of movements in a specific pattern. The T-test is commonly used in sports and fitness settings to evaluate an athlete's agility and quickness. Here's an overview of how the T-test is conducted. You will need cones or markers to set up the T-test course. 4 cones are placed in the shape of a T with 1 cone at the starting point and the other 3 cones forming the top of the T spaced apart. Begin with a proper warm-up that includes dynamic stretching, mobility exercises, and a light jog to prepare the muscles and joints for the test. The participant starts at the designated starting cones and sprints forward to the first cone at the top of the T. They touch the cone with their hand and then shuffle to the side, touching the cone with the opposite hand. Next, they shuttle in the opposite direction to touch the cone on the other side of the T. After touching the cone, they shuffle back to the starting cone. The time taken to complete the test is recorded using a stopwatch or electronic timing system. This test should be conducted multiple times to account for variations and obtain accurate results. Adequate rest periods should be provided between trials to ensure proper recovery. The recorded times can be used to evaluate agility and change of direction ability. Generally, faster completion times indicate better agility performance. The T-test results can be compared to normative data or used to track progress. On the way back at the very end of the test, they'll be running backwards. So you're running backwards. The Pro Agility Test, also known as the 5, 10, 5, or 20-yard shuttle, is a popular agility test used to assess an individual's agility to change direction quickly and efficiently. It is commonly performed in such sports such as football, basketball, soccer, and other sports that require rapid changes of direction. Here's an overview of how the Pro Agility test is conducted. You will need cones or markers to set up the course. 3 cones are placed in a straight line 5 yards apart with the middle cone as the starting point. Begin with a proper warm-up that includes dynamic stretching, mobility exercises, and a light jog to prepare the muscles and joints for the test. The participants start in a 3-point stance or a stationary position with one hand touching the starting cone. On the go signal, they sprint to the right and touch the line or cone 10 yards away. Then they change direction quickly and sprint to the left, touching the line or cone 5 yards away from the starting point. Finally, they sprint back to the starting cone to complete the test. The time taken to complete the Pro Agility test is recorded using a stopwatch or electronic timing system. The test should be conducted multiple times to account for variations and obtain accurate results. Adequate rest periods should be provided between trials to ensure proper recovery. The recorded times can be used to evaluate agility and change of direction ability. Generally, faster completion times indicate better agility performance. The Pro Agility test results can be compared to normative data or used to track progress over time. It is important to emphasize proper technique during the Pro Agility test. Participants should focus on quick and explosive movements, maintaining a low center of gravity and using efficient change of direction techniques such as pivoting and lateral shuffling. And that is all that I have for today. This concludes Chapter 11, Testing Protocols. I look forward to talking with you again another day. Have a great day.